3 years later, I am fully recovered and serving as a volunteer coordinator of the Drug Project. I also help out with advocacy research, event planning, marketing. And so I'm going to talk about what we do, what eating disorders are, and some of the issues people face in getting treatment and recovering. And hopefully this will, end, will be done in like half an hour, and then we can have questions. If you have a question during the presentation, you can just raise your hand or yell it out. Alright, so we kind of have a 4-pronged attack here at the Drug Project. We've got support programming, research, education, and advocacy. So support programming that we do addresses the problems a lot of people have obtaining adequate treatment. So our goal is to provide some alternatives for people who can't get any treatment or a supplement to whatever they can get. We have a really popular online support community, the in-person support groups that I talked about earlier, for which there are some flyers on the table over there. You can take those. And we also offer online self-help tools. What we're working on right now is getting funding to initiate a pilot program called Roots of Recovery, which is meant to mimic some aspects of the intensive treatment for people whose insurance won't cover it. Intensive programming is really important for eating disorders because people face the problem every time they need to eat. And individual therapy, which most insurance does cover, is not anywhere near enough for most sufferers. I needed a total of 7 months of residential. That was over two different stays. And about a year and a half of day or half-day treatment. And that's actually pretty quick for a full recovery. A lot of people take longer. So we want to create a structure that people can come to in addition to their therapy with some of the same types of groups and support you find in a treatment center without the licensed therapy. One of our guiding principles is that recovery requires active participation by the individual. No one truly recovers until they take full responsibility in deciding to recover, and then have to continue to make that decision for every day for a couple of years with a lot of support. One way that we empower individuals is to provide more in-depth information than you find on almost all other eating disorder websites. And this helped me a lot when I was dealing with those underinformed doctors, because I knew why I was experiencing a lot of things, and I knew how the disorder was manifesting itself better than they did. And I also knew that I didn't have to let their unintentionally harmful comments keep me from getting help. So I was able to keep looking even after being told by doctors I didn't really need this level of treatment, because I was educated enough to know that I really did, and I wasn't just overreacting. So a lot of this information can be found on the website, which is joyproject.org. But the Facebook page is actually a really good way to get the most recent information and research. We post a lot of current studies there when they come out. And then we also do training workshops about dealing with eating disorders in a helpful way for various professionals. We've done that with Planned Parenthood and SAMHSA, which is a big mental health organization, among others. So the research we do is aimed at improving treatment and diagnosis, and although we aren't a university or a treatment center with a lot of resources for conducting studies, we do have some advantages as a consumer-driven organization. We actually get a better sample than a lot of studies because our participants come from more diverse backgrounds and treatment histories than the typical small sample of convenience taken from patients who are able to get themselves into treatment. We have a really good base of people with eating disorders who trust us with their stories because we listen to them rather than telling them what an eating disorder is and what it entails based on potentially flawed research. And so, for example, we got 179 people to respond to a survey online in a 2-day period, which is comparable to the number of participations in a big university study. and actually higher than a lot of participation numbers in studies. Like you can see there, the anorexia studies have numbers like 23. It's not really statistically significant. All right, the advocacy work we do overlaps a lot with the research and education. In the past, we've lobbied Congress members, worked with the people who passed mental health parity recently on the bailout bill, which unfortunately still doesn't protect most eating disorder patients because of diagnostic problems. And that brings up another campaign we held recently to change the diagnostic criteria for anorexia. And we'll talk about that more later because it's a very big issue. But we did have some success with that. And then we're always trying to address the misconceptions that have evolved around eating disorders and create various barriers to recovery. All right, next section. What is an eating disorder? Just some quick general information. And this quote is taken from a Drug Project Forum member about her experience with a doctor who didn't have very much knowledge about eating disorders. I don't know if you, can you all read it? Do I need to read it out loud for you? I'll just read it quickly. I told my doctor about my eating disorder and she felt the need to inform me that men like women with a bit of meat on their bones and that if I want to find a good husband, I shouldn't be trying to look like Nicole Richie. I thought about telling her about my history of sexual abuse and the fact that I use my eating disorder so that I can be unattractive because I hate getting attention from men. But I just kept my mouth shut and nodded. So the comment from her doctor is actually having the opposite effect it was intended to have by reinforcing the cognitive distortion that being emaciated can protect you from men because they don't find it attractive. This is really common in eating disorders. It's also a factor in compulsive overeating, where the same goal is met by gaining enough weight to be unattractive. It's kind of a sad example of how people with eating disorders' voices are silenced. First, the sexual abuse silenced her, and then she continued to be silenced by the doctor and others who think she's trying to get a boyfriend. The eating disorder is there to speak for her, but unfortunately, most people don't speak eating disorder. So I'm going to try to give you some idea of what an eating disorder is so you may have a better chance of understanding what they might be saying. And we're starting with the pop quiz. So the picture on your left is A, picture on your right is B. Which one shows more women with eating disorders? So if you think it's A, raise your hand. All right, who thinks it's B? All right, answer is C, unable to determine from the information given. So that was tricky. Eating disorders come in all shapes and sizes. And you cannot tell by looking whether or not someone has an eating disorder. I mean, sometimes you can because there are signs, but you can't know that they don't have an eating disorder by looking at them. A lot of people with eating disorders never become emaciated. So never assume someone does or does not have a problem based on their size, and also what hormone is their sex. There's a lot of men who suffer with eating disorders, and of course all ages. Also, we don't have race on here. That's another one. There's a lot of stereotypes about white girls having eating disorders, and it happens, to every race. All right, so basic definition of an eating disorder is on the right, parentheses. That's my basic definition. It's using food to attempt to solve psychological problems. So that can cover a variety of behaviors. It's in the eye of the beholder. People typically don't say, I have an eating disorder if they don't have one. So usually they've probably already been questioning themselves for a long time about whether or not they're overreacting or just complaining about nothing. So it's not really necessary to question someone when they tell you they have a problem. And like I said, it's really important to know that people of any size can have an eating disorder. and either sex. The idea that eating disorders are a women's problem is invalidating to the suffering of so many males, men and boys, and it makes it harder to ask for help. And they're also very old and very young people with eating disorders, so it's not a teenage or college issue. It's really just a psychological problem that is manifested in eating behavior. All right, here's a couple signs, just a few. The quote here on the left is from a study done in the 1950s, where a bunch of healthy men had their food intake cut in half for 6 months. So they were still eating half of what they were before, but they experienced really serious consequences due to starvation. And that's important because it can be really easy to eat half of what you need and still appear to be eating normally. So people might say, she's not anorexic, she eats all the time, when really she can be experiencing all the same problems someone who eats nothing does, just by eating, half or maybe something like that. So this quote is about hoarding, which is kind of a curious consequence, and it's typical of anorexia. It's often misunderstood as a part of the pathology when it's, and I'm talking about misunderstood by, experts, as a part of the pathology when it's really probably just a symptom of starvation. So it happened to men who didn't have eating disorders previous to the study, and that's what the quote is about.